Hey guys, it's Charlie here. I just wanted to discuss my appointments with Jaco Erasmus, the psychiatrist from Melbourne. Because I live in a country town, I've been given the opportunity to have some appointments online via Skype. They're all bulk billed, which is excellent. I just want to talk about what we spoke about briefly, touch on everything. Maybe I can help some boys out there who might be wanting to see him, maybe want to know what to expect. I had my first Skype appointment on the 3rd of December last year. I think he's in the office Tuesday, Thursdays and Saturdays. I went and saw Vincent Cornelis, I think that's his name. He is a gender medicine professional and he sent me a reference to Jaco. Basically the first appointment we just touched base. We went through my details. He mentioned that a place that was an hour away from where I live would have been easier than travelling to Melbourne twice a month. Being from rural Victoria, going to Melbourne is your best bet. Things happen a lot quicker. They know what they're talking about. You just won't get fucked around. You won't get fucked around. We discussed my name change. We discussed my living arrangements. Obviously, he wanted to make sure everything was stable. Wanted to know that I was surrounded by support. Was interested in my current relationship and how that was going. I guess it would ease his mind knowing that I have support from many loved ones. Of course, he asked what I'm doing with myself at the moment, which is absolutely nothing. I guess I made it clear that my main goal and focus at the moment is to transition smoothly, to transition happily and fast. He then asks what I'm hoping he can do for me, and of course I said hormone replacement therapy. Please, I need the tea. I need testosterone. Jaco, help me. He then listed 3 things that he needs to cover and basically assess before writing me a letter to the hormone prescriber, which will be Vincent. Number 1, the desire to start medically transitioning and if it's appropriate. Number 2, is it safe? Number 3, am I able to give consent to this? Next, we sort of had to get comfortable with each other, making sure that our lingo was on par with each other. He basically discussed the difference between sex and gender, sex being the biological parts that I was unfortunately cursed with, different chromosomes and different hormones, and that gender sometimes isn't related to that at all. It's a social construct, pretty much where you feel in society and where you fit in to society. Society sucks. Just presuming things, I'm fucking over it. Anyway, after covering that, he asked me a few questions regarding how gender has affected me through my life, any impacts that would have, I guess, pushed me forward to this point in my life, how I've dealt with gender and its social constructs. He then got all serious and was like, what words fit you the best regarding gender? And I said, male. Male, male, male. Not express post, not fucking whatever other male there is. I feel like a man. Therefore, I am a man. We discussed when I began to notice things, then made me list the things that I noticed, which back then I would have had no idea. I would have just put it down to me being a little kid who just wore whatever he wanted, who got called things that he wasn't, but didn't think about it. It wasn't as important to me then as it is now. Now that I'm coming to a whole, it's sort of the only thing I think about compared to then where I was just thinking about eating my boogers and what Hot Wheels car to buy. We then reached primary school, and he asked, how was I? What kind of things did I do at school? What kind of group I hung out with? What kind of kid I was? He made me realize that my anxiety started very early on. We then hit puberty. We discussed how I felt as my chest started growing, as things exited my body that weren't meant to, which was fucking traumatic then and now discussing it. He asked about my sexuality in primary school, which I then said to him my sexuality was Hot Wheel cars. I didn't care about kissing anyone. I didn't care about anything besides my Hot Wheel cars and my skateboard. He asked how I felt being nude in front of the mirror, which was a terrible thought for me, and no doubt him as well. And compared to that, what I would like to see from my nude body, which again, difficult for both of us to think about. We discussed my trans to-do list, hysterectomy, top surgery. Please don't tell me I'm dreaming, but phalloplasty. Fuck. And then we ended it with talking about my diabetes, my medications I'm on. He then sent me a 2-page sheet via email of the psychological risks, blah blah, which I then signed and sent back. And that was it. That was it for my first appointment. My second appointment with Dr. Jaco was on the 9th of January this year. That was actually a Monday, so what I said earlier about him being open Tuesday, Thursday and Saturday, I was wrong. Sorry. Because it was my first appointment after Christmas and the New Year. We discussed that. I mentioned that I'd been getting called Charlie. My birth name was not even heard of the whole time. Okay, that was a lie. My birth name popped up a couple of times, but what can you do? This appointment was based on mental health, what I'd gone through, what I'm going through, how I tried to fix everything. He wanted to know if I'd seen any counsellors or psychologists or psychiatrists in my past. Year 8, I think it was my first counselling appointment. I tried out some antidepressants, they didn't work. He wanted to know what my extent was with my suicidal thoughts, suicidal tendencies, bad habits. It's a need to know thing. It's hard to talk about, but I'm trying to get better. So you've got to go through the hard yards before you can see the good shit. He asked me in depth about my family regarding their health history, mainly heart disease, liver disease, cancer, regarding living at home with only my mum, how that impacted my life, how that impacted her life, us living together, our relationship. We basically started at secondary school, went through everything, the dark ages of Charlie Finn. It was just trying to nitpick everything to figure out maybe this was a little bit earlier than what he thought. Maybe he just doesn't realise that, and he's been sadder for longer than he thinks. I'm well aware. We touched on my siblings and how supportive or not supportive they are. I basically just gave him a rundown on what they're doing, their age. He wanted to know how I am at the moment financially, what my plans are to increase my finances. And then he ended it with a massive questionnaire, 21 pages. They were just, 1, strongly disagree, 5, strongly agree, depression, gender, whatever. So that was it for my second appointment. My third appointment was again done through Skype. It was on the 19th of January. This one was a massive appointment. Probably not as big as my last one is going to be. Definitely not as big as my last one's going to be. But it was a hormone discussion. Now that we'd gotten through my whole life, things that, you know, he needed to know to make sure that I was stable enough for this, I was well, I was fit. Now we're getting down to the nitty-gritty, and I was so excited to talk about hormones. I'm always excited to talk about hormones. First off, he just gave me a minuscule rundown of side effects. Good, bad, risks. He tested me on the reversible and irreversible side effects of testosterone, which I got correct. Thank you, internet and friends. I was really scared that I would get tested and fuck it up, and he would think that I have no idea what I'm getting into, but I did it. We discussed the consent for medical treatments, which is pretty much just anyone saying, I consent to getting this treatment because I agree with this diagnosis. So we covered physical and biological effects of testosterone, psychological effects of testosterone, and the social impacts of testosterone. We talked about being pre-T, what I am at risk of compared to what I will be at risk of on T. I'm at risk of a happy life on T. So we spoke about what my plans for regarding if I want to freeze anything, fertility-wise, if I want to carry a child. He was saying that a lot of trans boys have this fantasy of what testosterone will do for them, and to not get my hopes up because everyone's different. I have come to terms with that. He mentioned that I need to drink less alcohol for the first 6 months of testosterone, which is going to be difficult because I'll probably be celebrating the whole time. No, I'm going to be a good boy. I'll be good. And then he ended on the best news I think I've ever received. He said he was going to send me a hormone consent form via email. It's 4 pages long. All I have to do is sign it, get him to sign it. That's me consenting to start testosterone. I consented a very long time ago, but this is it. This is a form saying, yes, I have this, and I need this to survive. Please give it to me. Please. So that's it for my first 3 appointments. My last appointment will be on the 2nd of February. It's a face-to-face. I take this consent form in, I sign it, he signs it. Testosterone's coming soon. It's coming really soon. And I'm so excited. I'm so excited.